From Lagos, the nation's commercial capital, this is the news at 10, live from Channels Television. Reported tonight,
Bimbo Oloyede.
Hello and welcome. Tonight, the World Health Organization, WHO, declares the Ebola spread in West Africa an international health emergency. The President announces $12 million Ebola emergency fund as government confirms 2 new cases. W.H.O State goes to the polls tomorrow to elect their governor. Security heightened across the state. And United States launches an airstrike against Iraqi militants.
And on business news, African Development Bank advises Nigeria to engage in global change to achieve strong, inclusive growth.
And on sports news tonight, Ivorian striker Didier Drogba quits international football after 12 years.
Aminda Kibian from Abuja. The Nigerian Medical Association rejects federal government's call to return to work as members insist on continuing with industrial action.
We begin tonight with concerns over the spread of the Ebola virus disease in West Africa, which the World Health Organization, WHO, considers serious enough to be declared an international emergency. The announcement came after experts convened a 2-day emergency meeting in Switzerland, where it was agreed that a coordinated international response was essential to stop and reduce the spread of the virus. The outbreaks have occurred in Guinea, Liberia, Sierra Leone, and Nigeria. The Director General of the WHO, Dr. Margaret Chan, says there will be no general ban on international travel or trade, but states should be prepared to detect, investigate, and manage Ebola cases.
The declaration of a public health emergency of international concern alerts the world to the need for high vigilance for possible cases of Ebola virus disease, but by no means implies that all countries, or even many countries, will see Ebola cases. Only a small part of the African continent is currently affected. Above all, the committee's conclusions and my decisions are a clear call for international solidarity. Countries affected to date simply do not have the capacity to manage an outbreak of this size and complexity on their own.
Also today, the President has declared the control and containment of the Ebola virus in Nigeria as a national emergency. In a statement by his special advisor on media and publicity, the President directed the Federal Ministry of Health to work in collaboration with the state ministries of health, the National Center for Disease Control, the National Emergency Management Agency, and other relevant bodies to ensure that steps are taken to effectively contain the Ebola virus. The President also approved a special intervention plan and the immediate release of 1.9 billion naira to strengthen ongoing measures to contain the virus, such as the establishment of additional isolation centers, case management, contact tracing, and the procurement of required items and facilities, among others. The President commended the vigilance of aviation and health authorities in Lagos, who identified and isolated the index case in Nigeria, the late Patrick Sawyer, an American Liberian who flew into the country last month to attend an ECOWAS conference. Meanwhile, the federal government has confirmed 2 new cases of Ebola in Lagos. The 2 are among the people who had primary contact with Mr. Patrick Sawyer. The Minister of Health, Professor Onyebuchi-Chukwu, was in Lagos today to give an update on the situation. Our correspondent, Yomi Otaigbe, now reports.
In here at the Central Public Health Laboratory building in Yaba, Lagos, The Minister of Health, flanked by his counterparts in information and other health officials from the Lagos State Ministry of Health, shares the latest data on the Ebola virus disease in Nigeria.
We have additional 2 confirmed cases. So the total now, we have 9 confirmed cases, of which 2 are late. The same 2 we told you about, the index case and the health worker. As we talk, we do have 6 suspected cases currently under investigation. Sometimes they turn out to be negative, sometimes we have a few who are positive, as we have experienced between Tuesday and today. Now, altogether, all those who have placed under surveillance stands as 139 now. Government also approved that all those participating in the care of Ebola virus disease patients and also even participating in contact tracing, all those part of the team should enjoy life insurance provided by government.
While the health authorities are trying to contain the spread of the Ebola virus, they have another challenge with some form of misinformation going around the country on the use of salt and water for bathing as a form of protection against the virus. A claim the minister said can only aggravate an already precarious situation.
Absolutely, it's total rubbish. It's a wicked lie. There is no evidence. There's no truth. It doesn't make sense that when you pour water on yourself and rub salt, if anything, you're going to have other problems. Let's manage with Ebola virus disease. Don't give us non-communicable disease, please.
For the Minister of Information, this is definitely not the time to peddle unfounded rumors, but a time for everyone to remain calm, cooperate with the government, and also take protective measures against the Ebola virus.
Anyone that has this virus and refuses to go out there and report to a health facility and stay where you could be safely treated, but would rather run away to your family or to your village, what you are doing is that you are taking this disease to more people. Huge prayer places where our people go to seek God, where our people go to pray for this country, and prayer is very crucial. We all here believe in God. So we're not doubting miracles at all. But now, with Ebola, our sincere caution is that anyone infected with this disease should stay in a quarantine facility so that we can pray for that person.
Meanwhile, commissioners for health from the 36 states and the Federal Capital Territory are expected to come together on Monday next week for an emergency National Council on Health meeting on the Ebola disease situation. Yomi Otaigbe reporting for Channels Television News.
Well, still on the Ebola virus story, states across the country are not only taking preemptive measures against the disease, they are also educating their indigents. From the north to the south, the message is simple. All hands must be on deck to ensure that the disease does not spread across the country.
Abia State, Nigeria's southeast region. There are no recorded cases of the virus here, but the Abia State government says it is not taking any chances. At this session in the state capital, Umuahia, Governor Theodore Orji says that vigorous public sensitization and education on the health implication and prevention of Ebola disease could help to reduce the spread of the virus.
We have this issue of sensitization of our people to make them be aware of this Ebola and its repercussion and what to do to avoid that.
A few minutes' drive from Abia State takes you to Imo State, also in Nigeria's southeast region. Here again, the Imo State government has commenced sensitization and awareness program on the prevention and management of the Ebola virus. The State Commissioner for Health, Edward Ihejirika, is asking all Imo indigents and residents not to panic as there is no identified case of the virus in the state. He adds that there are some government-owned hospitals in the state that have been designated as isolation centers to handle any suspected case.
For this government, a responsible and sensitive government to the healthcare needs of the people, have kicked in all measures and strategies to ensure that should this happen, we are able to arrest the situation.
In Kwara State, the Nigeria's north central region, the government here has set up a rapid response committee and an emergency preparedness and response committee to address the possible outbreak of the disease in the state. The State Commissioner for Health, Kayode Issa, says that all the general hospitals in the state have been sensitized and have Ebola management committee in place, comprising of doctors, nurses, and laboratory personnel to handle the disease.
For the purpose of demonstration that she does put on one pair of gloves.
All these measures cannot be said to be exaggerated, as the World Health Organization (WHO) has declared the spread of the Ebola in West Africa an international health emergency. With a known cure yet to be fully established, the states firmly believe that educating the people is vital if the impact of this virus is to be minimized.
In part 2, after the break, W.H.O State votes to elect governor for another 4 years. Do stay with us.